Hi, it's Jonathan Brubaker with the Movement Medics, and today I'm super excited to share with you something that could help correct a lot of your back pain, knee pain, hip pain, ankle pain. And really all these pains can come down to just one area in your body that is locked down, and that is your ankle. You see, your ankle should be able to allow you to bend and for you to bring your toes up closer toward your face. So in other words, if this were my foot, right, I should be able to allow my shin bone to translate over my foot about 15 to 20 degrees. But most people actually don't have this ability anymore. And because of that, other areas in their body try to create that mobility, and that leads to giving them a whole bunch of problems. So one of the first problems we commonly see here when we do an overhead squat assessment with anyone is that they go to do the overhead squat and they go to squat down and their feet, their arches collapse. They collapse and then their knees start to bow in. And this collapsing portion is the first thing that we really want to correct. Now, the reason their arches collapse is they don't have enough movement at that ankle joint, and so as a result, they try to find that movement by collapsing their arches because they can't get it enough naturally. Now, this is due to a couple reasons. So if you look on this side of the board, you see I've got labeled short, referring to short muscles that are affecting the ankle joint. And then we have our fancy terms, the soleus and the gastrocnemius. And those are the two big muscles that make up the majority of your calf down in your leg. And if those are too short or too tight, your ankle won't be able to get enough flexibility when you go to do that overhead squat assessment, or bend over, pick something up, or sit down, or any other number of things. And so as a result, you try to make up for it by collapsing that arch. Now, on the opposite hand, we have some muscles that have become too long. And because they're long, they can't actually contribute enough force to help prevent that collapse of the arch during the wrong time. And the muscles that are too long are the tibialis anterior and the tibialis posterior, and both of these muscles connect together underneath the foot and help lift the arch and keep it supported. So if you were trying to correct this yourself, you want to make sure that you would release and stretch these short muscles, namely the calf muscles and then the fibulary muscles on the side of the leg, and then you would want to strengthen these muscles that have become too long, the tibialis anterior and the tibialis posterior. So go ahead and try this out, see how you can stretch and strengthen the right things, and hopefully you can get a more functional ankle going for you. Thank you.